sets of minutes, one from November and another one from early January. Did everybody get the minutes or did anybody not get them? Okay. I'd entertain a motion to approve the first one from November.
Mr. Chair, I'd like to ask the clerk to read a letter from Dr. Hickey that was
Let's-
sent in,
Let's
as-
stick with the minutes first.
because that relates to the minutes. That's my reason for bringing it up now. It relates to the minutes,
Which minutes? To
the November meeting
November?
minutes.
Mr. Chairman, I've read the letter and I think that's a political statement. And if that gentleman wishes to make a political statement, he should be here and do that through the open comments section. So I submit to you that the request is out of order.
Yeah, I'd agree. We all have the letter and it's public, so people want to read it, they can.
Well, my thought is that it really is a reflection of the record, the public record. If, as the letter states, you misrepresented the vaccine reporting data and you misrepresented Dr. Hickey's opinion. So it feels to me like that's something that the viewing public needs to hear and the audience here needs to hear as part of the minutes from the November meeting.
Okay, well,
And
the
I
numbers
believe
weren't.
If he were here in town, he would probably be at this meeting.
He-
So it's interesting that everybody talks about how important transparency is, but you have a public comment that was submitted in a timely manner and you're unwilling to have it read into the record.
Well, we also have 100 pages from a presentation that was also supposed to be today, and I don't think we want to read all that into the record.
And nevertheless, if there's a problem with the minutes, point out the problem that you want something changed.
Okay, okay, I will. In fact, I will read the correction to the minutes. I will, so by reading Dr. Hickey's letter.
Hold on a second. So you have a correction to the minutes now instead of when the deadline was last week when the clerk sent it?
I did not receive Dr. Hickey's letter as a public comment until I believe Sunday or Monday. So yes,
All
that's
right, so
correct.
let's everybody turn to the minutes from November 21st. And please tell me what you would like corrected.
Absolutely. I'm going to go ahead and read his entire letter.
Well,
It's
No,
please
no,
don't read the letter. Just tell me where the
that is
clerk-
not proper, like I've
Yeah.
said. If that's a political statement. If the gentleman wants to make a political statement, he can come here. If a person wants to present a letter, they have to come here. Otherwise, we'll be inundated with garbage from here to eternity. Your
So-
job right now is to tell us what sentence or what part of the minutes you
Okay.
find inappropriate.
Absolutely.
Please,
It says during the minutes.
which page, what
Um,
section?
Do I have the minutes here? Under the medical freedom resolution,
Yes,
Chairman Lane stated that he pulled,
where on the minutes are you reading from?
it's under the medical freedom resolution.
Which paragraph?
It's under the heading. I mean, I guess you're okay with minutes going out with incorrect information and the public record being incorrect?
No, I'd like you to tell us where in the minutes it's incorrect.
The minutes are incomplete because you
Incomplete.
stated
Hmm.
that the VAERS system, that 318 people died.
Excuse me, do not read the letter. You've been reprimanded several times. Look, is there a sentence in there that you want changed? Look at the minutes, not at the letter.
There's a sentence I would like inserted that said,
No,
Mr. Lane.
Minutes
The
are just
minutes
a
have been-
reflection
the
of what
minutes have-
happened at the meeting.
That's right. The minutes have been
We've
sent
had a
out.
considerable amount of discussion regarding the medical freedom resolution. Did that happen? Yes, it happened, including the informed consent, the infection fatality rate, and the limitation of medical freedom resolution. So is there anything that is wrong about that? Did we not discuss any of that?
Are the medical record, or excuse me, is the public record supposed to be consistent with the minutes?
It
don't
is
know what
unless
that
you have
means.
something wrong in the minutes.
Minutes
Show-
are just a reflection of what we did. We had
No.
that
Yeah.
discussion.
I beg to differ. The minutes,
You're making the minutes more than what they're supposed to be.
Yeah, Mary Jane,
did
find the,
Did Mr. Lane indicate that 318 people died of the vaccine? in the
When was
public
that
record, did he
received?
give that did he state that as fact at the meeting?
Yesterday.
Okay,
It says
so
we had
not
a
part of the
considerable amount of
minutes.
discussion. So, yeah, we had discussion.
Yeah.
I struggle to understand why we are comfortable with inaccurate and inconsistent
Well-
and misleading information as part of the public record.
Okay, Mary Jane, I think we're really dealing with just the minutes of what happened at the last meeting. And I understand that that letter hadn't been written or received until what, 2 days ago? So
Right.
that wouldn't really be in our minutes at this point from
Well, it wouldn't
November.
be in the minutes anyhow, Lindy,
Well, I mean,
because
well,
the minutes are, I review the minutes for the board in general.
Right.
And those minutes belong to the person taking the minutes. And if there's something egregious in there that's misrepresented, we speak up. Otherwise, it's it's supposed to have in there what action was taking place. In this
Right.
case, there's something extra thrown in which says a big discussion occurred. I approve that.
Yeah.
Right.
It's not going to go into the discussion. So if you have new material to present at this meeting, then that's an opening.
So I guess I'm still, as I said a few minutes ago, I'm confused
Yeah,
as to why
Mary
this
Jane,
board
excuse
is
me,
comfortable.
please. You're out of order. If you find the sentence in the minutes that's incorrect, please state it right now.
So is it possible to ask for a verbatim transcript of the minutes? So,
It's online. It's all there.
okay, and forgive me for pushing on this, but I think it's important. Are the minutes supposed to be a reflection of the public record?
It wasn't in
The minutes are in front of you. They've been sent out over a week ago or about a week ago. You had time to correct them like every board member. I believe that was your choice a few months ago. You wanted that. So take advantage of when the minutes are sent out, and if you see a correction, I found a couple errors in it and I corrected it. So they are correct as far as I can see. If you can pick out a sentence that's wrong in the minutes, please tell us now. Otherwise, let's move on.
So would you answer my question? Are the minutes supposed to be a reflection of the public record? That's easy, yes or
They're,
no?
they're a reflection of the activity that happened Tuesday,
That
November
day.
21st, 2023. That letter was not in existence Tuesday, November 21st, 2023. So what it has to do with these minutes is zero, nothing, nada.
Well, so I would like the record to reflect the fact that this
You can have
board,
them come
is
up
not
here on
comfortable.
public speaking and read that whole dang letter right into it.
How about that?
I guess I'd like the record to reflect that this board is uncomfortable facing facts
We're
that were
uncomfortable
presented
changing,
incorrectly.
we're uncomfortable changing minutes of what happened 2 months ago.
It happened, though.
It-
It happened.
And this reflects what happened 2 months ago.
Okay, go-
Yeah.
You
go
reflect,
ahead. Move on. We're good.
So I'd entertain a motion to accept the minutes unless there are any changes or corrections needed.
I make a motion that we accept the minutes for November 21st, 2023.
Thank you. Motion on the table is to accept the minutes of November 21st, 2023. All in favor?
Aye.
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 Any opposed?
No,
2 noes? And I didn't hear, Alyssa? And an abstention. Okay, so we passed the minutes, struggled to get through them, but they're there, they're accurate. And the misrepresentations that you're trying to say are actually true. And I'm ready to,
Go on to the next
Yeah.
minutes, okay?
This one,
next
yeah.
minutes. Wednesday, January 3rd. We had a special meeting, it was a short meeting. Everybody got the minutes. I'd entertain a motion to accept the minutes,
I'm sorry, what meeting is this from now?
January 3rd.
I move to accept the minutes.
Thank you. Motion on the floor to accept the minutes of January 3rd. Any discussion on those? Let's call for a vote. All in favor of accepting the minutes for January 3rd? All in favor?
Aye.
Aye.
Aye. Aye, I think that was unanimous, yes. Unanimous. Okay,
While we are on the topic of unfinished business, though, I do think we should correct, since this is part of public record and we have, sorry. uh, there is information, I agree with Mary Jane that there's information that's incorrect on how VAERS is being used and reported, and that's something I understand pretty intimately. I just want to make note that any vaccine, anyone from the public can go onto VAERS and make an unsubstantiated report of a vaccine side effect. There is a report of someone being turned into the great incredible Hulk from taking a vaccine. That was on VAERS and unsubstantiated until it was looked at. So pulling numbers straight from VAERS is an incorrect way of looking at vaccine side effects. And I think that needs to be noted because there is a record of incorrect health information on there, even if it's not reflected in the minutes.
But even at that, it's a two-way street.
It's a two-way.
The interpretation by the beneficiaries of the interpretation are aplenty in any situation. And so maybe we'll get onto that a little later, but you can't use VAERS and you can't use VAERS on both sides of the equation then.
All I'm saying is to throw out numbers from VAERS that are unsubstantiated reports is a really egregious misrepresentation of what's going on with vaccines. I don't think we should be throwing out data like that from people who might not truly understand what that data means. That's all I'm saying. And I think you're agreeing with me.
I think I agree with you, but I also note that it's very well used by other situations, and I don't know where that line is drawn. I think it is probably useful for us not to throw any numbers around. And in that sense, we certainly agree.
yep. Okay, so moving on to the next business. Interim health officer.
I make a motion to hire Dr. Krieger as the interim health officer.
Thank you. Motion on the table. Let me explain it first, but that's good. We have a temporary situation now that where the regional health officer of the state is acting as our health officer for our county. They have been very nice to go for longer than their typical 2 weeks. And because the RFQ for a health officer is going to expire in mid-February, we need a little bit more time. And it also takes from any time that this board makes a decision, it has to then go to the Board of Commissioners to be a final contract or approval. So therefore we need a interim health officer. I have spoken to Dr. Krieger. He's not here, but I did speak to Dr. Krieger, and he has generously volunteered his time and said that he would do our the interim position for 2 months. And well, yes, sorry, I don't mean volunteer, but he offered his services to be the interim health officer for 2 months. And so I'd just like to get that out of the way. That way the state can go on their way and we can thank them, and we will have our own interim health officer to get us through the period, which is roughly 2 months until after our next Board of Health meeting, where we can hopefully appoint an official permanent health officer. So I'd entertain Lindy made a motion to have Dr. Krieger to fill that position for the next 2 months based on the contract date of the BOCC.
Can I have a question? So is it your intent then that he would then transfer from being the interim to being the permanent contractee as the health officer?
We'll see how the RFQ goes. That's not up to me.
Okay, but we should know by the end of, by mid-February if there's any other applications. Is that correct?
That's correct.
Okay.
Is there?
We're not gonna, and maybe Carol or Gina can answer this. I don't want to sever the relationship with the state. We want to maintain that just in case something happens
Oh,
down the
yeah.
road, right?
Oh, yeah, they will
Yeah,
always,
not
no,
say- We don't want to have to go through the whole application process.
no,
right?
they will still be there for us in case the health officer takes a vacation or is out sick,
Okay.
they can come in. And I believe that Gina and Carol have got an idea of how to write the contract or the agreement with them, so we can just call upon them anytime. They're shaking their heads, yes.
Yeah, I think, Mr. Chairman, you might want to discuss, Dr. Krager is not with whom we had the earlier contracts.
Yes, lots of misinformation out there, and it was in the papers and the other places. Dr. Krager was the deputy health officer working for Dr. Melnick. That relationship is what the board in November decided to terminate. We didn't terminate, the contract expired. And so now we are talking directly with Dr. Krager only without Dr. Melnick. And that's where we are right now.
And I'm not sure how to say this, but Dr. Krager is stepping out, and he is trying to do us a favor with no quid pro quo implied. So he knows that sometime at the end of 2 months or so, there'll be a decision, and we may choose him or we may not choose him. He has no pretense involved there, and I give him a lot of points there.
Yeah.
Another comment I make is the RCWs are such that even though we're coerced now to do something else without a regional, because the regional health officer wants out, it leads me to question what the real motivations are with everything along the chain of the health officer. This is clearly not an onerous thing to act as our health officer over a longer period of time. I'll stop there, but you get the point.
Just to clarify on that note, that the regional health officer in the statutes, their regulations are to typically serve for 2 weeks. So they've gone a little farther than us. It's not that they want to get it out. It's just they've already provided a little bit more than the 2 weeks.
But sort of, that's my point. They want us to have a health officer, and they'll say they'll act as health officer for 2 weeks. And they're kind enough to continue, but the question then begets, what if it takes us 4 months to replace our health officer that got somehow called off to some other situation and cannot continue as a health officer? Does that mean the state does not appreciate how difficult it is to find a permanent health officer? It's like they don't give us many alternatives, but they'll press our hand, if you will.
That's a good question.
So another point of clarification. So if, this motion is approved and Krager serves as our 2-month interim health officer, and then the request for qualifications closes February 15th, and we've received no other applications, then do we go back to square one and submit another or publish another request for qualifications?
I think we'll discuss that after the RFQ closes. We'll vote on that at the next meeting. So, any further discussion on the motion on the floor? Okay, so the motion on the floor is to hire Dr. Krager to be our interim doctor, and I believe this is a recommendation to the Board of Commissioners. Is that correct? There's a recommendation to the Board of Commissioners to do the contracting, because this board doesn't contract, the Board of Commissioners does. So, all in favor of that motion?
A question, a point of information. It's hard sometimes for me to keep straight some of the boundaries between the Board of Health and the Board of County Commissioners. Normally, I would want to hear from the public if they have anything to say at this point. Is that something you would support or not?
Yeah,
support?
actually, that would be just fine because the next item up for business is going to be postponed. The speaker we had to give a presentation is called in sick. He's sick today, and so we have a little bit extra time. So yeah, I open up to the public if anybody would like to say anything about the interim position of Dr. Krager. Any hands? No? Okay. Well, with that, put it to a vote. All in favor, say aye.
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 Aye. I believe that's unanimous. Okay.
So
So
if you'll extend appreciation to Dr. Krager for putting himself out on our behalf.
I will, and I already have, and yes, it was very nice. So that will get kicked over to your agenda at your convenience. The next item, like I just said, was the medical freedom discussion. But the presenter is sick, so we're gonna postpone that.
Can I just
Uh,
ask a question about that presentation?
Hmm?
I'm a bit confused because we passed it. We talked a lot about how it was a statement without much teeth on it. It's not going to do much. It seems like as a board, we may not be keeping up to date on some of our more duties as a board, such as getting a health officer contract or looking at budget. I'm a little bit confused about why this is on the agenda, I guess. So if you could explain that, I'd love to hear that.
Well, we just took care of the health officer, so I think that that was not correct. Secondly, I think during the discussions that we had over the medical freedom resolution, I believe several people, including Mary Jane and yourself, said that we don't know what went right or wrong during the COVID pandemic. And I think that that question deserves some exploration. I think we need to find out what really went wrong and what went right. And since you guys proposed it, that is basically the intention of discussing it.
And my question to, I don't mean to interrupt. My question to that, or my thought about that is, what are Mr. Youngren's credentials? And does he have the qualifications? Does he have the experience? Does he have the data background to provide us with, and has there been enough time passed to make some definitive decisions and analysis of what went right and what went wrong with the COVID situation? Because I guess I'm not familiar with him. I don't know where he's done his research. I don't know what his qualifications are.
Yeah, he's quite qualified, but I'll let him talk when he's here about his qualifications. But basically, he's doing lots of presenting, and I urge you to read this thick packet that the clerk prepared. Thank you again for preparing all this extra information. There's a lot of information in here, and I urge you to read it before the next meeting and to digest it. There's a lot of information. There's new information coming out every day about it. And well,
I guess I would say, I just don't think we have the resources as a Board of Health with certain duties and obligations. Again, yes, we got the health officer pass delayed, late, like it expired. We left the public without a health officer. It just seems like maybe we should get back in touch with what our duties are as a board, more so than trying to do a review, research, analysis. I don't think we have the capacity as a board to really do that. I mean, we could have one person talk, and you know that there'll probably be people in the public and then the board who disagree with what Mr. Youngren says. And we could have someone else come with different views, and we could go back and forth, but I don't think it's the board's capacity to analyze COVID or how it went. I think that there is other things that we could prioritize, and I'd love to hear some of those. And I've heard them from everyone on this board, things like mental health, things like, overdosing and drug use, things like there's funding from public health funding that we might not be accessing for our county that could be put to good use. I'd love to hear more about that from our Department of Health and Human Services. So I'm just going to throw out there that I'm not sure that, while I do agree we don't know how everything was handled and it could use a lot more assessment, that's necessarily the best use of the board's time at this point.
How do you feel we should proceed with that, determining as public? What could we suggest then, as far as how do we find out who should be the ones that determine what would be done next time. I mean, I'm at loss about what a lot of things that did happen, but yet I don't see anyone that's actually doing what somebody is doing to say, this is what happened and maybe we could do it a different way. And so because you're in public health, I bet you might have some ideas about that too. Cause we're kind of grabbing at straws about what to do, but somebody needs to do something so that we don't have another COVID pandemic, and we know there probably will be another one, but what do we do next time that would be different? So I guess that's kind of where I am and why I'm here.
Yeah,
So my comment is, I don't know why we are beating this horse to death. We've already spent 4 meetings talking about the medical freedom resolution, and it has been approved, it's been passed, it's in our rearview mirror. I think it's important that we take a look at specific public health issues that relate specifically to this county. I have personally sent out a number of requests to Mr. Lane asking for agenda items to be added to our agenda that deal with, what the health department sees as their priorities, what the health officer sees as his priorities for our community, how the county is dealing with overdose and drug use. And I've not heard any responses. So I think that while it's important to keep the COVID issue and the pandemic issue relevant, I think that we also have some fires that we need to put out in our community. And so having spent 4 meetings on the medical resolution feels like, I hate to use the word overkill, but it feels like we have other fires to put out.
Ernst?
So, Mr. Chairman, I think it's incumbent on any of us, each of us on the board to submit to you requests and for you to put a balanced agenda out there. Now, specific to this medical freedom resolution review, that I read that and I interpreted that as a misnomer because, and it certainly sort of tends to be true. When I take a look at this is not a medical freedom resolution review. It really is a review of the COVID. It's a post-mortem about COVID. So in that sense, Mary Jane is correct. The freedom resolution is back, but I'm very, very tolerant of misnomers. So I don't find a problem here. I would ask which of each of these members has submitted to you, and apparently Mary Jane has. And I would submit that I would probably respond to that saying this topic, and this topic are for the future, or come back and dialogue and ask what could be done, or you could use some of the meeting here. Now, frankly, I've been around enough, unfortunately, that I'm a little bit jaded because I've heard the presentations from the health department on STDs, on this and that, on opioids, who had the coroner talk and yak, and nothing ever really comes out of that. A suggestion from Alyssa about the budget might be interesting. Trying to bear down on the budget is something we really haven't ever done, and maybe this board is the right one to say the health budget is something we should be concerned about.
Yes, and I'd actually credit that to Commissioner Weber, asked for that before, and it is on the list, as well as the other 2 items that Mary Jane asked for. So you're trying to say that I'm forgetting or ignoring your requests, and that's absolutely not the case. The truth is that we did ask HHS, the Health and Human Services Department, to prepare a presentation as you requested on overdoses. HHS is working on it. In fact, we gave them some more information the other day. They did not have the time to do it, and it's not going to be exactly on your schedule, but it has not been forgotten. So I resent
So
that.
a little quick email to me would have been nice.
Actually, if you go back and read your emails, I did say exactly that, and
No,
I'll
you did
find
not.
it for you if you
I'm
want.
sorry. I didn't get it. If you
Well-
sent it, I didn't get it.
Well, could I just throw out that this couldn't be a ad hoc work session, could it, where we could throw out some concepts and see what the public thinks about some of what we have in mind and maybe use the last few minutes? Would that, because I think you guys have got some good ideas.
Yeah,
And let the public, you know,
I got,
join in.
I would like us to step above the he said, she said stuff that I've been
Yeah.
hearing.
Me too.
That'd be nice.
Yeah.
And what I typically do is I want to look forward ahead, and if I need to, I'll talk to you behind the scenes, but right now, we have some issues. I personally think that the budgetary questions should probably be put out front first, because we want to know where things are allocated, and each of us has a notion of sort of priority and intensity of effort that's involved. Then later, we can look at the data individually. Just to be told how many people died of opioid overdose doesn't do me a lot for decision processing here. Now, if I'm told we've spent no dollars at all on the opioid problem and we have lots of deaths, that's kind of the thing. So I'm not trying to find things down to the 10%. Are you sure it was 19 and not 20 people? You know, I'm just.
Yeah, well, and because we did have a cancellation, if you like, in my list of notes, it is set up for the February is to talk about the budget. But since, would you like to, Commissioner Weber, since you are the one who proposed that, kind of give a brief introduction of what we should focus on for the budget? I don't mean to put you on the spot. I'm just trying to give you the credit that you did ask for it. Sorry. If you don't want to, we don't have to. It's not on the topic, and technically, we're probably not supposed to talk about it.
I'm not prepared.
Okay.
Okay,
Yeah,
yeah,
you did surprise me. One of the unrelenting facts of government is your budget sets your priority.
I'm sorry.
By
I
the
can't hear
state
you.
law, our budget establishes the priority. What we spend money on is the priority. I mean, that's just basic. Our job under state law is to set the priorities. We haven't done that yet. And that's, we haven't looked at the budget. I said that 6 months ago. We needed to be looking at the budget before the county actually passed the budget. Because we had to pass the budget before the end of last year. So what we can look at is, how about next year's recommendations? Where direction are we headed? And what are the areas that we've got gaps, and what are the areas that, we have a good appreciation of the money that we're spending, and what are the possibilities? But it would take a little bit more time and data to come up with
exactly.
a
That's-
budget response, but
I agree, it takes more time. If we disagree, it's take the money pool and do not use it as an index of what we should be doing. Take a look at the outcome and decide what that should feed back into the money pool.
it helps to form the priorities. Yeah.
Yeah. So at the moment, we've inherited a list and a process, and we've been struggling with trying to figure out how to go about that. I personally am thankful to have more in this, in the board, because it's not a thing that we could set, like 6 months, we'd still be struggling if we had begun right then, because it's a complex issue.
So it is on the schedule to talk about is the budget. I think, HHS will try and be ready by then, hopefully. Gina, yeah, you want to talk about it? And can you also clarify that you've been working on the overdoses as well, so the board knows?
Yes, and I would be helpful to clarify kind of what meeting we're talking about for these items. We had a conversation about looking at some opioid data, so we are working on that. We also had planned, and this was kind of a carryover from last year, the local prevention coalitions to come. So we're confirming that, but we have that planned for February's meeting.
Correct, that's
Mhm.
correct.
Along with, reviewing the RFQ responses that come in as well. So we have those items kind of queued up for February's meeting. I don't have anything in my notes at this time for March. That might be a time to plug in a budget conversation. potentially still discussion on RFQ responses or health officer as well. And then for the April meeting, I know the group has kind of asked about meeting the regional health officer. We have talked to him a little bit about potentially coming in April for the April meeting. So those are some of the items that I have in my queue for future Board of Health meetings. And if I missed one, let me know.
No, that seems right on schedule with mine. Drug overdoses, probably maybe more like March, sounds like.
Maybe I don't know if we'll have time in February to cover those things so we can.
And- And possibly to meet the regional health officer at that time too, if he's available or afterwards.
We have that kind of plugged in for April.
April?
Yeah.
That's okay. And then the school coalitions are still on track for next month.
February, yeah, we're confirming again, but that's what we had planned.
Gina, what are you going to do with the school coalitions?
The representative from ESD 112 who oversees a couple of the different coalition programs in town in Cowlitz County was going to come and share information about what the coalitions do, what their efforts are, how they're working on child and youth prevention activities locally.
Okay.
Thank you for that. So yeah, everything is covered. Everything that's been submitted is covered. Just take some time. Government goes a lot slower than we all want.
Could I ask Gina another question? Do you work with the Longview Drug Task Force? Or is there a sheriff's department drug prevention task force that goes out to the schools, or does the Longview schools do that at all? Where they go in and do assemblies and talk about the effects of drug abuse and very
I'm
specific?
not sure if law enforcement does. I know Longview has a coalition that does some of those.
So I've met with the coalition at Kelso and at Castle Rock coalitions, ESD coalitions. And they take a very soft approach to educating kids, at least in my opinion, on drug prevention, because they don't want to scare the children about what drug abuse could do to them or have anything like Mothers for Mad. I know I really am old, so I date back to that, but that scared me looking at the car all mashed up and all the scary videos. That did make an impact. And they won't do that because they say it's too upsetting to the either parents or the children. So I don't see that. And so I interviewed a ninth grader at a meeting one day, and I asked him, it was just kind of a random thing. And he said that he was from RA Long, and he said that, the kids sit at these meetings and listen to the speakers and they just kind of laugh at them. And I'm not saying that to be cruel. They just kind of make a big joke out of it because there's nothing that really grabs them and says, wow, this is really a bad thing. It's just don't do it. It's not good for you. And,
Mhm.
but there needs to be graphic stuff that maybe does scare them.
If I could
But
interrupt
that's
you.
just my opinion. Thank you.
Yeah, if I could interrupt you, we're trying to plan what should be presented, not discuss what the issues are being presented,
I'm sorry,
specific.
I'm out of order.
What I suggest is that we've all seen the numbers, we've all seen everything. That isn't enough. We would like a statement of what methods are being tried, what things that would fall into something there. And that's where we could maybe be helpful. It would also be helpful to have student body representation, because clearly in many cases that's the target. Unfortunately, I feel that the way we handle the drug situation is not conducive to progress. In fact, every time a kid overdoses, I feel we are complicit in that, but that's a different issue.
And that is another item that's on my list of many items that we should cover is something we started talking about last year is how we can reach into the kids, into the schools, and maybe do some more assemblies. I think the first assemblies of anti-drug education, vaping, smoking, drinking, the whole bit. I hear commercials on the radio and TV I've seen recently of they're talking about vaping, but only tobacco. People don't know that you can vape cannabis and other things as well. So there's a lot to talk about. We don't have the time today, and I think we're going to start it off at the school coalitions, but it's something that's been one of my priorities, but we got to get through these other things that keep coming up first.
And I think I'll just add with, learning about what the coalitions are doing, part of inviting them in, if I remember right, was to learn about what strategies they're doing. And then, with some of the opioid information that we're looking at, we can also talk about potential strategies that this board might be interested in pursuing, knowing what the coalitions do geared towards child and youth. We can also consider other strategies, and it ties into the budget conversation too about what funding might be available to implement those strategies. So I look forward to it.
Thank you.
Sounds good.
Excuse me, can I talk about new business? I have two issues, two concerns. First, I would, the Board of Health agenda comes out on Thursday and our meeting is a Tuesday. And as I look at the daily news and see their listing of all public meetings, the Board of Health is not included on there. And I would like to, I guess, maybe ask staff or staff, I don't know, to make sure that the Board of Health meetings it makes sense to have the Board of Health meetings be listed in the newspaper, and also a press, I don't know who to look at here. And also have a press release with the agenda sent out to the daily news and to the radio. And also, I don't think it'd be a bad idea to have the agenda on the Health Department Board of Health category or Facebook page. Just because
That'd be great.
it's such short notice, and we do want more participation, and we do want to see a bigger crowd and people engaged in this process. So that's one issue, and I don't know if we can make that happen, if we need to have a motion to make that happen, or if that just makes good sense to invite public participation.
I believe it is posted when when you send the agenda out. Yeah, maybe the clerk can explain.
The agenda is sent out to the KLTV, and also it's sent out to the newspaper each week.
How about the Facebook page? I mean, I
don't-
follow the Health Department's Facebook page, and I think they do a great job with lots of topics. And I know that you probably have a calendar of what you're gonna have where, life jackets or seat belts or whatever, but it feels like the more people we can get interested in the process, the better job we'll do. So I would just encourage everybody to try to make sure that agenda and the minutes are circulated more broadly within the community. The other issue that relates to this, and I'll try to be quick, is that our bylaws specify that the agenda needs to be sent out at least 5 days in advance of the meeting, which is great, except for that becomes a Friday and a Monday. And so I would like to propose a motion to modify the bylaws to say that it will be sent out 5 business days prior to the meeting. So that gives folks time to schedule.
Let me stop you there. We had a discussion about that with the attorneys, and the actual statute says 24 hours, not 5 days. The bylaws says 5 days. It doesn't specify business or not, and the clerk's schedule has been set up to do it on the Thursday before,
Right.
on the Thursday before, which is 5 days.
Right. I understand that, but is there a problem with tweaking everybody's schedule? The work's going to need to be done. Is it possible to make it 5 business days? And again, to allow for a higher level of public participation? Is that problematic, or can we revisit that at the next meeting so that we can have a higher level of public participation, which I think we all
I
all
think
appear-
I think that's a good idea to give people more time to be able to see it.
Well, I would leave that up to the clerk if you can do it on Wednesdays instead of Thursdays.
Well, I'm saying 5 business days. So would that be Wednesday, Thursday, I guess Wednesday, Thursday, Friday, Monday?
Well,
I don't know how you count it.
I would like to submit that the board has been in this business for quite a while, and I talk off in other places, and invariably someone will always say, well, I didn't know. I don't think there's much, I mean, we got so much to do on the table. It doesn't bother me either way. I can go either way. But it's not the kind of thing I would pay any attention to, because I cannot associate another 2 days as providing me assurance that more people will see it. So I just worry about things that we can see.
And I understand that. The other thing it does do is it gives your board, your Board of Health members time to study the agenda and study the issue. So I think to me, if there's no downside, that there's no good reason not to allow the public and the board more time to study the agenda.
Does
I
it,
don't see why not.
does it make a burden on staff or money? Is it a
It-
budget or?
It does.
There's a burden to
There's a
staff?
small burden. It's gonna change my schedule. It's gonna change the clerk's schedule. And
The
I
only-
think that
oh,
I think that already we've just said that it does go out to the newspapers, so they know, they've had time.
I haven't seen it yet and I get the daily news every
Same here. And they
couple
may not
days,
call
whenever it
a
goes.
Priority.
It
I really
goes
haven't
out,
seen it.
we just don't know if they're interested,
Oh.
but it goes out to them, so it's quite posted quite publicly. Kelly?
I would just, it's intertwined with our Board of Commissioner meeting. And that isn't, final until Thursday. So sometimes there's changes, like we had a change this week, having to move it to 10:30. So it would just take a little more tweaking of,
Y-
possibly having some changes to it.
Can you tell us what a little more tweaking means?
Just time-wise, if we have something that conflicts on the Board of Commissioners.
We pay quite a bit to put stuff in the paper. Does this increase our cost to put anything in the paper because we're going to on a different day?
What was that again?
So if we adopt the suggested change, does that mean that you're going to incur additional costs to put something out?
I
There is a
am not-
difference between, because what Mary Jane points out, we could in a gentleman's agreement decide that that 5 business days beforehand, the board will have the agenda. And then it goes out only 5 calendar days is. So if it's free, we just do it all at the same time, 5 business days beforehand. If it's not free, then I think we can agree between ourselves to do it 5 business days ahead of schedule. Is that not right, Mr. Chairman?
Yeah, I don't know if it would change much in the participation.
The
But-
cost is almost zero.
If the cost is 0, yeah, we could,
I'm saying the cost for us to be more attentive a couple of days ahead of time is,
I think we'll talk with the clerk and see what kind of schedule they can come up with, and I will put that on the agenda to discuss the next time. So at this point, I think I'd like to open it up to, unless Mary Jane, you
Nope, that's it. Thank you.
have, public comments.
I'm a little confused. I heard a couple of board members, excuse me, I came from the dentist, my bottom jaw is completely numb, so I probably can't mumble. I've heard a couple of board members discuss or question who's qualified to testify about this medical freedom resolution, or in that case, anything that you want to discuss or you want to research, who's qualified? Do they have to have a PhD? You got the staff gathering information to give you feedback, what's their professional research and analysis capabilities? Are they just going to give you statistics? So I hear you, some people questioning what's the qualifications for somebody to give you a report. And then I hear you turn around and say, let's get more public input because we really care about what they say. Well, what's their professional analysis? I mean, do you give a crap about people's input, or do you really want professional analysis? Because those two things don't go together.
yeah, if I might, I really appreciate what you're saying. It's a point that has irked me somewhat because I have typically as much or more formal education than an MD. And I've never taken a look at something and said, well, that comes from an MD, so it must be true. I look at the data, the message, and try to evaluate the message independent of the messenger. Does the message make sense? Could the messenger understand that correctly? Is all kinds of ancillary stuff. But basically, do you have a PhD? I don't care.
I'm
Thank
not gonna tell you. No, I don't have. one. Anyway, I think that research and analysis is a good thing for what you can get. But it's not always gonna be accurate depending on who's doing the research and the analysis. And you gotta take it with a grain of salt. At the same time, public input is exactly what you're supposed to be looking at. And what does the public care about? And who's qualified and whose word would you take for analysis of the drug and opioid problems, the overdose problems going on nationwide or in our own county? You know, where do you draw that level of what you care about is local and we're gonna try and control it? How much of it can you control with all the crap that's coming across the border and how much of it is ending up here? I don't know where you're gonna try and control that. I think the education part to get into the schools and talk to the kids, I think, and try and give them a level of understanding that in turn gives them a level of protection is critical. I think that would be a major step forward in the education process to try and slow down the drug problem, the addiction problem, whether it's drugs, alcohol, tobacco, I don't care what it is. Awareness would be a first thing to try and get kids to understand the risk they run to get involved with that crap. That's my 2 cents.
Thank you for
Thank you.
that. That's good to hear because that's the direction that I've been trying to go. There's lots of drug problems out there, and I think the only thing we can really do is focus on the kids and the youth. More public comments?
Just to note, whether you call the report of people coming up, for instance, Bill Youngren's medical freedom or postmortem, I believe that we would all like to see some form of information that we can digest and see the both sides. We certainly, most of us that are cognizant know that certain portions of our society are pushing the next levels of coronavirus or whatever else. Some of us have concerns that our president may even declare martial law or whatever they come up with. So we want to be prepared and under our own medical freedom choices to make our choices and support you and us in having medical freedom. Thank you.
Thank you, Ralph.
Thank you. Yeah, the public has said this often, so I don't think it's a waste of time.
Hello, thanks for the opportunity to provide some public comment. Public health is a broad array of essential services, from keeping our drinking water and food establishments safe, to identifying and managing communicable diseases outbreaks, to utilizing data to understand and prioritize health issues across our population. While water testing, disease reporting, and statistical data may not be exciting topics that drive public engagement, they are critical tools for our local Board of Health to get information. I've reviewed the meeting minutes of 4 local health boards to get a better understanding of how counties similar to ours manage their limited time to cover the broad range of public health topics. I looked at Cowlitz, Grays Harbor, Lewis, and Wahkiakum counties for the time periods since July 2022. Most of the counties I reviewed have time every meeting to get updates from their public health director and their health officer. During these updates, Board of Health members hear about department staffing changes, learn about significant activities like community assessment and planning, and hear about disease activity in their community. Most counties also using time at most scheduled meetings to learn in depth about one or more programs or services provided by their health department. While I'm heartened to see that counties smaller than Cowlitz are able to continue delivering the full range of public health services and to keep their boards informed, I was sad to see that Cowlitz County stands out against others in our region as having very little public information available about public health in our community. I learned more about the other counties' public health systems just by reviewing their minutes and I have learned about our own county's public health from attending and watching our local Board of Health in action. Where other counties have maintained an ongoing dialogue between department staff and their boards, Cowlitz County BOH doesn't give their staff any agenda time to provide regular updates. Where other counties have provided their boards comprehensive community assessments, reports, and strategic plans, Cowlitz Board of Health has had one presentation on sexually transmitted infection. Where the minutes document of other counties' meetings contain plenty of information to convey the many topics covered and the depth of the discussion, our own county's Board of Health minutes don't even always cover all of the items on the agenda. In comparison to other nearby counties like ours, our Board of Health is not very well informed about the department's work, and our public records poorly reflect the diverse and important work performed by the department. To better inform our Board of Health and to bring our public meetings more in line with similar counties, I would really like to see a standing agenda item every month for our health department director or deputy to provide updates on staffing and department key activities. I would also like to see monthly or quarterly updates from the county health officer on local disease activity. Please consider how adding these recurring agenda items could increase the awareness board members will have about our local public health system. I believe these enhanced awareness would provide board members with deeper insight into the policies and priorities they can enact to make meaningful improvements to health in our local community. Thank you.
Thank you.
Thank you for your comments. Just one clarification that what you said was not true. The health department is consulted before every meeting, and we are on the same page, and they have a presentation, they'll give us a presentation. So they're always consulted. Any further discussion or public comments? Okay, with that, we'll adjourn the meeting at 11:33. Thank you for coming.